Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the submandibular triangle, also called digastric triangle. First of all, we'll go to the boundaries. So if we look at the image, this is the submandibular triangle. This area is submandibular triangle. This is a part of the anterior triangle that is present in front of the sternocleidomastoid muscle with multiple subdivision. Like this is the submandibular triangle. We have this is paired triangle. We have another on the other side. This is unpaired triangle, submental triangle. We have the muscular triangle here, the carotid triangle. These are all of them are the paired triangle except the submental triangle. Okay, we'll go through this part, submandibular triangle here. Anterior inferiorly bounded by the anterior belly of the digastric. Posterior inferiorly it is bounded by the posterior belly of the digastric and the stylohyoid muscle. The superior border or base of the submandibular triangle is formed by the lower part of the body of the mandible. We can also call it base of the mandible, and an imaginary line drawn from the angle of the mandible to the mastoid process. Okay, so if we look again in our orientation, this is the anterior triangular area. We have the submental triangle, we have the carotid triangle, we have the muscular triangle, and we have the submandibular or digastric triangle. Okay, so again, this is the carotid triangle, and this is the posterior triangle here. Okay, and we'll give emphasis today on the submandibular triangle. Okay, so we got the boundary again we have to know that bounded anterior inferiorly by the anterior belly of the digastric, posterior inferiorly by the posterior belly of the digastric and the stylohyoid muscle, and the base is formed by the base of the mandible and an imaginary line from the angle of the mandible to the mastoid process. Now we'll go to the roof of the digastric triangle. It is formed by the skin. Skin has been taken out from this place. Okay, then superficial fascia containing three structures. What are those three structures? One is the platysma, that is a flat muscle, and this is also a muscle of facial expression, platysma. We have cervical branch of the facial nerve. Cervical branch of the facial nerve innervates the platysma muscle. We know that we have five branches of the facial nerve, that the temporal branch, the zygomatic branch, the buccal branch, the mandibular branch, and the marginal mandibular branch and the cervical branch. That cervical branch supplies the platysma muscle. Okay, so nerve supply of the platysma is the cervical branch of the facial nerve. There is motor innervation, and this roof area is also getting cutaneous innervation from the transverse cervical nerve. Here we have some ascending branch. These are cutaneous branches. Okay, and also from the great auricular nerve around the angle of the mandible. Okay, this nerve has root value C2, C3, and they are coming out of the cervical plexus. So these are sensory, but this muscle has a motor innervation, that is a branch of facial nerve. There is a cervical branch of the facial nerve, and this is a muscle of facial expression. Deep fascia splits and enclose the submandibular gland. Submandibular gland is a salivary gland. Floor of the floor of the digastric triangle is formed by the mylohyoid muscle, anteriorly, hyoglossus muscle posteriorly. A small part is also contributed by the middle constrictor of the pharynx. So, a small part of the middle constrictor of the pharynx also appears in the floor. Okay. So, contents of the digastric triangle. Anterior part of the digastric triangle contains the submandibular gland. This is the submandibular gland. The facial vein and facial artery. Facial vein, facial artery. Facial artery is a branch of the external carotid artery, and we know that facial vein will unite with the anterior division of the retromandibular vein to form the common facial vein that will be open into the internal jugular vein. We have the submental artery. From the facial artery, we'll get the submental artery. It is not shown here. Okay, that artery, along with we have the anterior content, other content are the mylohyoid nerve and the mylohyoid vessels. Mylohyoid nerve is the nerve which supplies the mylohyoid muscle and the anterior belly of the digastric muscle. It is a nerve that is a derivative, it is a branch of the mandibular nerve. There is a nerve of the first pharyngeal arch. We have here anterior contents, submandibular lymph node. These are located superficial to the submandibular gland with some variation in its exact location, but it is superficial to the submandibular gland. It is a big area of lymphatic drainage, and submandibular lymph node. It pick up lymphatics from the forehead, from the nose, paranasal sinuses, upper lip, upper part of the lower lip, the gingiva teeth, except the lower incisor teeth. Okay, and it this all lymph drains into the submandibular lymph node that will go to the jugular digastric or jugulo-omohyoid lymph nodes. Posterior content, lower part of the parotid gland. So the parotid gland is separated from the submandibular gland by the stylomandibular ligament, and we have the external carotid artery that is also a content. External carotid artery is a branch of the common carotid artery. We have deep structure, the internal carotid artery, the vagus nerve, and also the internal jugular vein. These are contents of the carotid sheath. They are very deeply located. Okay, they are separated from the external carotid artery by the styloglossus and stylopharyngeus muscle, and also by the glossopharyngeal nerve. Okay, so if we go to the content of the anterior part, we have the submandibular gland, facial artery, facial vein, submental artery, mylohyoid nerve. Mylohyoid nerve is located on the mylohyoid muscle. We'll add one more, that is the hypoglossal nerve. We must add one more. Content of the anterior part of the submandibular or digastric triangle is the hypoglossal nerve, which supplies all the muscles of the tongue except the palatoglossus. Okay, we got the content of the posterior part of the digestive triangle. Okay, we'll go to the now the Viva questions. What are the possible Viva questions? What are the boundaries of the submandibular or digestive triangle? We got the anterior belly of digastric, posterior belly of digastric, base is formed by the base of the mandible, and an imaginary line from the angle of the mandible to the mastoid process. What are the contents of digastric triangle? We have the anterior part content, posterior part content, anterior part content. We have the submandibular gland. We have the submental artery, mylohyoid vessels and nerve, and we have the hypoglossal nerve. Okay. What are the posterior content of the digestive triangle? The parotid gland. We have the glossopharyngeal nerve, stylopharyngeus, styloglossus muscle, and we have the content of carotid sheath like that of the internal jugular vein and the vagus nerve and the internal carotid artery. The external carotid artery is a superficial branch of the posterior part of the digestive triangle. An external carotid artery goes through the parotid gland and divides into two branches. One is the superficial temporal, and another is the maxillary artery. So, external carotid artery is also a content of the posterior part of the digestive triangle. What is the nerve supply of the platysma? Again, the cervical branch of facial nerve. Nerve supply of digestive anterior belly anterior belly is innervated by the mylohyoid nerve because it is a derivative of the first pharyngeal arch. Posterior belly is innervated by the facial nerve because that is a derivative of the second pharyngeal arch. Stylohyoid muscle innervated by the facial nerve. Mylohyoid muscle is innervated by the mylohyoid nerve. That is a branch of mandibular nerve. That is a derivative of the first pharyngeal arch. Stylopharyngeus is a nerve that is a derivative of the third pharyngeal arch, and it is innervated by the glossopharyngeal nerve. Middle constrictor of the pharynx is innervated by the pharyngeal plexus that is contributed by the vagus nerve carrying the cranial root of the accessory nerve, the glossopharyngeal nerve, and the nerve from the superior cervical sympathetic ganglion. What structure forms the floor and roof of the digestive triangle? Floor, we got the floor is formed by the mylohyoid, hyoglossus, and partly by the middle constrictor of the pharynx. Roof is formed by the skin, superficial fascia, and the investing layer of the deep cervical fascia. What is the relation of the facial vessels to the submandibular gland? Facial vein passes over the submandibular gland. Facial artery passes deep to the submandibular gland. What are the areas of drainage of submandibular lymph node? From the forehead, nose, paranasal sinuses, upper lip, upper part of lower lip, the gum, teeth, except the lower incisor teeth. Okay, and what structures are located between the external and internal carotid arteries? These are the stylopharyngeus muscle, styloglossus muscle, glossopharyngeal nerve. Why the digestic, and also we'll add also the styloid process. Why the digestic muscle is dual innervation? Because it is coming from the first pharyngeal arch and second pharyngeal arch. First pharyngeal arch forms the anterior belly. The second pharyngeal arch forms the posterior belly. Which muscle derived from the third pharyngeal arch? And what is this nerve supply? That is the stylopharyngeus muscle. Nerve supplied by the glossopharyngeal nerve. That is the ninth cranial nerve. What is intermediate tendon? There is a tendon that connects the anterior belly of digestic to the posterior belly of the digestic. And this tendon pierces the lower part of the stylohyoid muscle. Okay. And that's all about the anatomy of the submandibular triangle, also called digestive triangle. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me. Have a nice day. Bye now.